So I hope already mentioned that NCI conducts these national surveys, and she talked a lot about the adult in-person survey. So now I'm going to focus on the staff stability survey. So again, this is a national survey, and the goal of this survey is to really get reliable data on staff turnover rates, wages, benefits, and retention policies. And so they kind of are doing this and collecting this database of information as a way to aim to reduce costs associated with turnover and also reduce the impact of turnover on the individuals we serve in terms of the quality of the supports that they receive. And so we're going to look at some of the results of the 2016 Staff Stability Survey. And in that, we saw that there was a 51% annual turnover rate. And now this was, Ohio was very close to the NCI national average at about 46%, which is the average across the United States. And so it's kind of showing that there is a trend across the US that there's a pretty high turnover rate in terms of the direct support professionals. And they also looked at when these DSPs do leave, how soon into their employment do they leave. And it looks like under 6 months of being employed is the most common, so about half the DSPs left with under 6 months of employment, 21% at 6 to 12 months, and then 31% of those who did leave at over 12 months. So this means that providers do have to start from the beginning training new people pretty frequently if they're having less than 6 months of time on the job. And this slide, for some reason we lost all of the words, but we still have the pie chart, so that's the most important part. So this pie chart is showing the Ohio Provider Agency full-time vacancies. So the 19,811, which is the biggest gray chunk of the pie chart, are the number of filled full-time DSP positions. And the red wedge there is 1,896 vacant full-time DSP job opportunities. So that means at any given time, we need around 22,000 direct support professionals to support the population we currently have in Ohio. And so that means 8.7% of those positions are actually open. And so some of the consequences of that are a lot of overtime services seen with the current staff and a lot of burnout, which could contribute to some of the turnover rates we've seen. And something else to consider is that although Ohio is right at the national average pretty much across the board in terms of wages and benefits, there are still a lot of provider agencies that do not have a paid time off, bank, health insurance, or sort of a career ladder leading to higher opportunities within the field. And so that's something else that could also be contributing. So we seem to have some sort of supply and demand factors kind of in competition with each other. So how are we going to increase our supply of direct support professionals and even on the flip side, decrease the demand so we can kind of even out this workforce? And to do that, there are several benefits and training for support staff retention and then also complementary services to help alleviate staff demand. And we're going to go into each of these resources in more detail. So the competency-based training and longevity add-on, which I'm just going to call the competency add-on to make it a little easier, that was effective as of July 1st of this year. So it's a fairly new add-on. And this means that the state reimburses providers an additional 39 cents per 15-minute billing unit, and that equates $1.56 per hour. But in order to get this extra or additional reimbursement, they have to have at least 2 years of experience with state or county funded DD services, and then also at least 60 hours of applicable training. So this is really an incentive for DSPs to stay in the workforce a little bit longer, work up to that 2 years of experience, and get this added benefit in terms of an additional amount per hour. And so that helps with kind of the supply issue and encouraging longevity in the workforce. And then there's also the Employer Resource Network. This is something that is nationwide, but there is an Ohio-focused network, and it is a collaborative effort across the state. It has both public and private collaborators, and they're really working to improve retention of this DSP workforce through support and training. So they help improve the employees' skills, they prepare employees for advancements, and then they also do training on things for like computer training, budgeting, problem solving, and leadership training for these direct support professionals, and also agency and organizational management. So it's kind of a support to help improve both the employees and the organizations. And one of their main training models that they use is called Bridges Out of Poverty. This is specifically a workshop for managers, and it's a one-day interactive seminar. And in Ohio, 14.6% of Ohioans are considered to be living in poverty, and that's actually higher than the 14% average across the United States. So chances are a lot of the future employees or interviewing individuals for these positions could be considered to be living in poverty. So this really helps managers get a better awareness and understanding of kind of where this population is coming from, and it helps them get some training to learn how to build relationships with individuals in this situation, how to help them with problem solving, and work to get them moving from welfare to more stable long-term work. So both encourages employee retention and also works to get an underserved population into the workforce. And so another section that we really needed to work on is the demand that we have for DSPs. 22,000 seems to be a really high number for the workforce needed for our population. And so one way to kind of mitigate that is with remote support or monitoring. And so this uses supportive technologies to help individuals accomplish tasks in their own home or else provide care from a distance. And this is done through assistive technology such as an iPad or an Alexa or some other form of technology that can help an individual improve upon their functional capabilities or maintain their functional capabilities with communication apps or being able to use voice commands to use phone calls or turning things on and off in their home. So kind of a way to help them be more independent. And then there's also remote monitoring, which uses sensors, cameras, and FaceTime technology to have direct support professionals that are off-site work with individuals in their homes and provide support remotely.
Meet Brad. Brad likes soccer and hanging out with friends. He also has a developmental disability. That means different things for different people. But for Brad, it means that he sometimes has seizures and has trouble remembering things. He uses tools, like lists and calendars, to help keep him on track. Brad also has a family that loves him a lot. When Brad told them he was ready to live on his own, they wanted to support him, and they were concerned about his health and safety. The service and support coordinator that helps Brad coordinate his services through his County Board of Developmental Disabilities talked to Brad about remote monitoring. Remote monitoring is a Medicaid-funded waiver service that uses technology to promote a person's independence and safety by having staff in a remote location. There are a lot of different tools available through remote monitoring, things like sensors that trigger alarms, as well as door cameras and monitors. Remote monitoring tools can be customized to best fit someone's needs, no matter their age or their disability. Brad needed a tool that could help him if he had a seizure while he was home alone. He uses sensors installed in floor mats to help detect if his movements become irregular, and can alert someone remotely of a possible problem. He needed a tool to help him when he forgets things like taking medicine or turning the water off after using the sink, so his sink has a flood detector that shuts off the water if Brad forgets to do it. He also uses a medication dispenser that alerts him if he hasn't taken his pills. It can even send his family a text message if he misses it a second time. The remote monitoring tools Brad uses every day support him in being more independent in his daily routine and help him live on his own. The tools put his family at ease because they know he is safe. They also know that they will get an alert if something goes wrong. Brad now gets to live more of the life he wants. Thanks for watching.
So that was a really nice overview of remote supports and remote monitoring. And so with that, we wanted to see if there was any difference between rural and urban counties in terms of utilization of this remote monitoring service. So overall in the bar graph, you can see that the numbers are pretty close in terms of the number of users per 1,000 waiver participants. So 5 people per 1,000 in the rural and 6 people per 1,000 in the urban of waiver participants are utilizing this service. And so as of fiscal year 18, we had about 215 users, and now already on the amount authorized for fiscal year 19, it's around 300 users. And so while they're pretty similar in the aggregate numbers, you can see on the map with the counties that there are some distinct differences. The darker the green, the higher number of waiver participants that are utilizing this service. So you can see that some counties are really adopting this feature, like Williams is at about 38, Paulding is at 36, Seneca is at 43, Wyandott's 51, while some counties haven't adopted this at all. So it's kind of a good way to see that while rural and urban may look similar, there are quite a few differences within the counties. And so another program in place to help with this kind of demand for DSPs is the Ohio Shared Living Program. This shared living program is an option for individuals with an IO waiver, and unlike adult family living or adult foster care, this program can apply whether or not the caregiver is related to the person. And so this is something that we hear from providers in rural areas that because of the long drive time, it's kind of harder to get to some of the people they're serving or to get to more individuals. And in this program, they could actually have the opportunity to live with the individuals that they serve and have an in-home caregiver service. And so it kind of allows for a more stable, familiar home environment. And again, caregivers can be family or friends, roommates, or staff members. And so within Ohio, we again looked at rural versus urban. And we saw that, again, in the aggregate, it was pretty much the same across the board. About 73 users per 1,000 waiver participants are utilizing this Ohio Shared Living Program. And again, this data is from fiscal year 18. But when you look at it on a map by county, there's definitely some pockets of darker green areas that pop out, such as Noble, Monroe, and Morgan have 200 to over 300 participants per 1,000 waiver participants in this program. And then Williams, Defiance, and Paulding in the northwest corner have 150 to 200 participants. So again, between counties, there seems to be very much of a difference in utilization of these different programs. So with that, we have given you a lot of information, an overview of DODD in general, some information on cancer screening rates between rural and urban, and then also a lot of information on NCI and the programs we're using with the staff stability DSP information.